Welcome back. My next guest is Dr. Owen McGonigle, who is an orthopedic surgeon with Bluegrass Orthopedics. Welcome.
Thank you. Thanks for having me.
We talked about sports injuries, and I always think summertime people get hurt. They sprain an ankle, they hurt a knee, but a lot of people hurt their shoulders. Give me some examples of sports injuries in the shoulder.
Sure. I think a lot of shoulder injuries are going to be sport specific, and so coming into fall season, we might start to think about football as one. We start to think of traumatic things such as shoulder dislocations or AC joint sprains. We're coming off of baseball season, and baseball season, end of spring and into summer, we start to get into overuse injuries, and so we can start to see kind of overuse things regarding either the rotator cuff or labrum with that sport. But each sport will kind of have its own specific set of risks that we tend to see.
What do you think you see the most in terms of shoulder?
Again, I think it is a bit seasonal, but I think when I think of high school sports and certainly traumatic injuries, I think shoulder dislocation is number one. And when I say dislocation, that it can include an out where it dislocates and you have to go to the ER to have it put back in, but there's also episodes where people will have it slip in and out of place and know something happened to their shoulder, but it goes back into place, so they don't always present to an ER or to my office right away because they're not sure what happened.
Well, now shoulder dislocation and shoulder separation are two different things.
Yes, yeah, and that can be very confusing because they obviously sound very much alike. When we talk about a shoulder separation, another word that we'd use is an AC joint injury. So that stands for acromioclavicular, which is the end of our clavicle bones as it meets our bone called the acromion. There's a bunch of ligaments that hold that stable, and typically that's an acute injury where someone lands directly on their shoulder, and one or multiple of those ligaments may tear and can lead to varying degrees of instability through that joint.
So how do you know that you've got any of those?
Yeah.
What's some red flags?
Yeah, with the acute symptoms, when we talk about something like a dislocation, most people are pretty aware that the shoulder's not where it should be, and they are extremely uncomfortable. That is something that most people don't sit and live with. They're going to the ER right away, and that's what they should do because that shoulder needs to get reduced. Typically with something like an AC separation, there is pain. They might not have that same sense of the shoulder being out of place, but they are not generally, certainly at first, willing or able to move the shoulder very well. They have limited motion, they have limited strength, and so these things are usually fairly obvious that something is wrong with me, and that leads to them being evaluated hopefully sooner than later.
And one thing that you mentioned might slip up on you a little bit, and not necessarily always sports injuries, rotator cuff.
Yes. Yeah, and so that we're kind of talking sports. In a sports setting, that's a little bit less common to have a true full thickness rotator cuff tear as an acute injury. Now it can occur, but I do see it a lot more as more of an overuse injury. Mentioned in the sports setting, that can be from a baseball thrower or an overhead athlete, but for our kind of recreational athletes, and as people get older, and particularly kind of people who do more laboring type jobs that are heavy on the shoulder, we see that wear down over time, and that can start as just pain. Some people will have a fall or an injury, they might say that leads to that, but a lot of people, it will be just something that starts to bother them and eventually gets to the point where they check it out, and we might get an image that shows that tear.
All right, now, so are the things you can do, I know if you're playing a sport, it's a risk, but are there things you can do to prevent injury?
Yeah, exactly. Certain things, wrong place, wrong time, you can't prevent it. But for the most part, the best way to try to prevent injury is through physical therapy type exercises, and there's a lot of muscles that are involved in the shoulder and the rotator cuff. But if you look at our scapula or our shoulder blade bone, there's 17 muscles that attach to that bone, and so if any of those get out of position or certain get stronger and certain get weaker, sometimes we can have imbalances that develop. And so keeping those muscles strong, some muscles our upper back strong that kind of support our shoulder in these athletic activities is the best way to try to prevent these from developing in a more of a chronic situation. And so that can be something that takes a lot of different exercises to do, and so that's why I say physical therapy, because oftentimes you might need someone to kind of bring you through it at first in order to understand kind of the best way to do it.
Well, that's great information. We appreciate it. Again, appreciate the care you give, and thanks for coming in and tell us about it.
Absolutely. Thanks for having me.
And if you've got shoulder pain, Dr. McGonigle can help.